Now let's get started at 12:03. Okay, so we will start with a roll call, and then we'll go through introductions if anyone's name we didn't call. Shelley Entrican, Barb Long, Audra Miles.
Here.
Bill Coffin.
Here.
Greg Boynton.
Here.
Hannah Fuchs. David Luder. Mary Patton. Allison Borland.
Here.
Tracy Gowell.
Here.
Shannon Peterson. Megan Brake. Alicia Dahl. Tyler Rogers. Darren Howlett. Alexander Maxwell. Here. Don Harper. Here. Jody Scott. Here. Angel Marinich. Here. Dr. Shammer Robinson. Here. Kylie Rathman.
Here.
Chris Mitchell.
Here. On the phone.
Connie Shiley. Jim Bremner.
Here.
Greg Cassidy. Megan Bree and Shelley Renewson online.
I'm here.
Okay, thank you.
Yep.
And who's this? Greg and Shelley. Sorry, we have two. Is it your phone? All right, we do not have a quorum today, so we will table some of the minutes for next time. All right, so let's go around the room to anyone else whose name I didn't call. New people joining. So let me start with my left. Just say your name and who you represent.
Everyone, good morning. My name is David Welcome. I'm the Business Operations Project Manager with the Department of Education. I'm staff for I'm here with IDOT, I'm the Program Manager for the section.
Anyone whose name already called you because not here.
Jared, Sun Village Transportation.
Okay, so online, we've got Shelley Richardson. Do you want to introduce yourself?
Hi, my name is Shelley Richardson, as Rima just said, and I'm the Executive Director of the Statewide Independent Living Council.
I see a lot of phone. Oh, also we have Gavin from Tri-County. You want to say hello?
Hello, everybody. I'm Gavin with Tri-County Regional Planning Commission. I'm a planner.
Oh, I see we have Brad from CityLink. Say a greeting.
Hello, Brad Siltman with CityLink. I'm the Assistant General Manager.
Is there anyone else on the phone or online who I missed?
Hi, Raymond. This is Shelley Entrican from Fulton County Rural Transit.
Okay, got you. Thank you for saying that. I think we didn't hear you before, so now we know. Okay, we get everyone online on the phone?
I'm sorry, Rima, what did you say?
I'm just making sure that we got everyone. So we've got you, Chris. Thank you.
Thank you.
Okay, moving on to public comment. Any public comment today? No? And
Well, this is, Rima, I'm sorry, I was muted. This is Shelley, and I just want to thank you for allowing me to attend this meeting. All of you, just so you know, I'm very proud of Rima. She does an excellent job at what she does, and she's such an asset. And I'm just glad to be here and listen in on everything that's going on.
Shelley, that's kind of you to say. All right. Anyone else have anything to say for public comment? Okay. Moving on to approval of minutes. So unfortunately, we can't do this today, but does anyone have any comments about the minutes? And Chris, I know that you mentioned one comment earlier, so we've got that written down. Anyone else have any corrections or notes? All right, we will table that for next time. Okay, now without further ado, I'm going to share Greg's presentation. We're going to learn about Knox County Rural Transit. Okay. Good. Is that working well?
Yeah, I think so.
Okay, if not, just let me know. I'll tap it from here.
For those of you that don't know me, my name is Craig Boynton. I'm the transit manager in the PCOM for the city of Galesburg. We currently provide fixed route services and complimentary paratransit services in the city of Galesburg with some service contracts that are expanding out into the county. A little bit of background, the city of Galesburg brought the fixed route service in-house in 2019 rather than outsourcing the service as was in the past. We'd always taken care of the paratransit portion of it, but the fixed route service was outsourced and we brought that in-house overall under one building. There are 3 transportation systems in Illinois that are currently managed by municipalities. Those include Galesburg, Macomb, and Quincy. The city of Galesburg received a grant from IDOT in 2024 to complete an analysis study of our current transportation system and the merits of expanding transportation into the county. As many of you know, this is one of the IDOT's goals is to move to where we have transportation across the board through all the counties in Illinois. I know Quincy is going through a similar study as we are. Included with that study, there's also a primer process that is involved with the RPAC. So we're doing that side by side with the actual study that we have. We wound up hiring Nelson Nygaard to perform the study last year. And involved with that, there was community engagement, public meetings across Galesburg and Knox County with different entities, including the city of Abingdon, a coffee group that's in Oneida, a smaller community, also the city of Knoxville, Abingdon and Knoxville. So, communities from Galesburg and Knox County. We also had rider satisfaction surveys and unmet needs, feedback incorporated into the service planning. The vendor also collected cell phone data for tracking of traffic patterns to try to determine what routes we might need to consider for the future, and then discussion with hospitals and business entities to discuss their needs. We set up a committee basically of community members to get their feedback so that we could move forward with the project. Study findings. Study findings, growing need for rural and countywide transportation. This is to address the food desert in Knox County. Also a need for transportation for medical appointments and social interaction. Provide transportation for those individuals in the county that do not have transportation and do not meet covered categories of complimentary paratransit. One example that was provided to us was from Carlson College. They actually had some scholarships that were unused because of the fact that people that qualified for those scholarships outside of Galesburg did not have adequate transportation to get them to school. So this is one of the areas that we're trying to address in the future. We also looked at updating the fixed route system in Galesburg, which will be for another topic in December. That involved addressing the changing traffic patterns in the community. Some of the service concept ideas that were provided from the study included expanding the fixed route traffic or fixed route service into rural Knox County, demand response transit for low density areas, and then pilot routes connecting Galesburg and Monmouth. Monmouth is in Warren County, which is our sister county, and we're trying to develop a relationship with them for providing transportation back and forth with the community, both communities. So it gave us a new regional vision. Some of our goals: countywide mobility for all Knox County residents. By offering services countywide, we'll be able to reach an additional population of approximately 20,000. Galesburg's population is 30,000, so this will give us a complete population of 50,000 served. Coordination with Knox and other counties, like to build partnership with the other counties so that we can provide a method of getting individuals into the county for services, shopping, and socialization. Strengthen links between communities within the counties for jobs, healthcare, and education, and then update and expand our fixed route services in the future for Galesburg to meet the needs of today. Benefits to the region. This would provide improved access to jobs, healthcare, and education, improved access to food options, reduce transportation barriers for rural residents, and promote social equity and community connectivity. Current challenges: vehicle infrastructure, the vehicle fleet analysis to support service expansion. We've all been in the same boat where we're waiting for vehicles. We are lucky in the fact that we did receive 7 paratransit vehicles this year. That will cover us for what we currently have. So we still need to expand on those vehicles. And then we also have to address our fixed route vehicle situation, which will hopefully be addressed within the next year as well under the CBP. Vehicle procurement planning underway will focus on the reliability of accessibility for all riders. Adequate staffing, having sufficient qualified drivers in place to meet the demands of increased ridership. We're in a unique situation in the fact that as a government entity, we fall under IMRF. So we either have full-time or you have part-time, but if you have part-timers can't go over 1,000 hours a year, because if they go over 1,000 hours a year, then you qualify for retirement benefits, which increases our costs. So we have to monitor our retirement benefits, our part-time hours very closely. Budget funding, ensuring that we have adequate local match to support the cost of expanding services in Galesburg and Knox County. So I put together a forecasted 2027 budget, and this is based without expansion, but it is taking into consideration expansion of the fixed route system that was recommended by Nelson Nygaard when we look at our system. So that gave me a total budget of $3,430,741, which we range right now at about 2.8, 2.9 million without that expansion. Just a little pie chart of the revenues, which you really can't see very well on there, or bar graph, I should say. So this is the revenue forecast that we have. And as you can see, that leaves the city with a local match coming in at $778,004.61, which is very difficult for to get that kind of money out of the city. We average around $500,000 to $550,000 a year from the city, which we're blessed in the fact that we get that as local match. And that's not utilizing our full budget. If we're able to utilize the full budget right now, our budget would be $4,679,000. And obviously that's not attainable the way it is right now. So that's what's really important is the House bill that's out right now, or increasing the amount of DOE match. That's key for everybody in the future. So that would take us from 65% DOE to 80% DOE, which makes a huge difference. Current local matches that we have service contracts with colleges, an annual service contract in place with both Knox College and Carl Sandburg College. To provide ridership on the fixed route system for our students and staff. Annual service contracts in place with Knox County Housing Authority to provide rides to their residents. That's funded through a grant from the Galesburg Community Foundation. We have an agreement with the Galesburg Township to provide reduced fare passes for sale for their distribution on the fixed route system. Agreement with Veterans Assistance to provide rides for qualifying veterans on the fixed route and paratransit system. Agreement with Western Illinois Area on Aging to provide paratransit rides to individuals 60 years of age and up. And that is actually one where we're going out in the county. That's kind of to get our feelers out there so we know what people really need out in the county and if there's more that we could be serving. And then the city of Galesburg provides a remaining match. I did pull some figures this morning just for ridership, and WI AAA ridership in state fiscal year 2025 was 5,667 rides provided, as opposed to the previous year, which was 4,521. So it's increasing quite a bit. And our KCHA, the Knox County Housing Authority, rides on the fixed route actually almost doubled from 2025 to 2024. So our fixed route system is definitely being used. Local matching opportunities. I'm working on a service contract with Graham Hospital, service contract with OSF St. Mary's Hospital. I've met with Thrive of Knox County to help them out with any of their overflow that they have. Service contract with Knox County Health Department. We have applied for Medicaid transportation, which everybody tells us will be huge. We're just wanting to see what it's going to be like. And I actually just got an email before I got here that we have been approved for Medicaid. So we're looking forward to that. And then I also look into a service contract for Fresenius Kitty Care. Local match opportunities, additional service contract with Safe Harbor Women's Shelter, service contract with Galesburg Rescue Mission, and a funding ask of Knox County for the expansion of services. As a part of the expansion into Knox County, our city manager feels that if we're going to go out of the county should have something in the pot for doing this. So I reached out to the chair of the county board, and they have set up a steering committee. So we're actually talking about the funding mechanism for that. As far as getting our feet wet through the WI AAA service contract, we have started offering transportation in the county for those who qualify under the agreement. We've begun the process of applying for Medicaid, as I indicated before. We've scheduled meetings with Knox County to discuss potential funding. And then through these programs and conversations with entities, we are reinforcing that there is a demand and need for public transportation to our rural communities in Knox County. Our total ridership for between fixed route and paratransit for 2025 was 121,078. In 2024, we were 109,402. So we had almost an 11% increase in ridership in the year. So we're looking forward to continuing that growth. So the next slide is expenses with expansion, and that brings us up to a budget of $3.975 million. And revenue with the expansion, which you can see in there on the next screen came in. And to balance out the city, would have to come up with a local match of approximately $765,000. So that's where that local match is key in finding a local match to offset what the actual cost is going to be, because I know I'm not going to get $765,000 out of the city. So I got to do what I can to bring those costs down or to find more local match. That, in a nutshell, is the expansion for that county that we're working on right now. We do not look at this happen until state fiscal year 2027. We're hopeful that it will happen. But again, as I said, we have to make sure that we have county buy-in. So I'm aggressively working with them to make sure that they get it in the budget. And then Rim asked me to speak in December about the fixed route system. So I'll talk about that. Can I answer any questions?
No, I'm out. Do you have any guesses why the ridership increased? I mean, that's That's pretty significant.
We have been, well, actually, in working with the Knox County Housing Authority, that's been the biggest jump for our fixed route ridership. And I can attribute that to the staff at Knox County Housing Authority because their staff is very aggressive on making sure that their clients know about the service. And they have actually expanded it out to more of their buildings. So they have their two main buildings in Galesburg, but then they also have some other satellite buildings, so they're adding those. And then as far as the paratransit side of it, WIAAA has been the biggest expansion on that.
For the service contracts, did you approach them? Did they approach you? How did that connection work?
We've approached, and then as people hear about the service contract, some of them approach us. So it's been kind of convenient because OSF, we approached OSF about a service contract. Well, Graham was trying to get their foot in the door at Galesburg. So once they found out that we had a service contract with OSF, they're like, or that we're working on a service contract. We went in too. So they were actually faster to sign than OSF. So OSF's a bigger company, so there's a lot more red tape to go through with them. So if anyone has any other ideas on service contracts, I would love to hear them because try to get that local match.
Like you're making good progress.
Trying to.
I guess for the Medicaid, how was that process to get involved in that?
Medicaid, we reached out, actually, and this kind of goes with our software too. So you need to have a good software in place for the billing. So one of the recommendations we had from spring conference was we talked to another entity that uses CTS. So when we actually had a grant for new software because we've done everything paper and pen. And when we added the software, one of the criteria was the fact that they would do Medicaid billing, that they would easily do Medicaid billing and it'll retire with Medicaid. So CTS wound up being the company that we chose for the software. So we're just getting our foot in the door there. We reached out to Medicaid and started the application process. You basically, you have to provide all the drivers that you're going to utilize. They have to have an authorized background check. You have to provide all the vehicles, and then they do a site inspection of your site as well as your vehicles. And now we're at the point where we'll begin the process. Okay, how do we do the billing? How do we set up the appointments? That type of thing. So,
Is that for public transit as well as paratransit?
I envision it being for the paratransit side of it. It would be considered an on-demand type service because the way the rides are scheduled. And I know one of the entities that we talked to, they secure probably close to $200,000 in Medicaid revenue every year. So I lowball it in my budget because you don't know what it's going to be. So if we can get $200,000 out of it, fantastic. That just means I can spend more money. So
Is it a lengthy process?
Evan said it was a really lengthy process, but we have been able to actually do this in probably about 3 months. So I didn't think it was bad.
They're having a party out there.
They're excited for us.
Yeah. Any additional comments, questions?
If you come up with any, feel free to reach out to me. We have to walk through.
Well, this is great to hear. I know that there's just a few counties, and maybe IDOT can correct me if I'm wrong, there's not many counties left in the whole state of Illinois that don't have public rural transit yet. So this is one that's getting the ball rolling.
Anderson, Lawrence, Adams, maybe Winnebago. It was 4.
Winnebago is now taking Reagan.
Okay.
Henderson's the last one.
Getting there.
And I think Warren's working towards that one.
Yeah.
Yeah, Morgan, who is the person there, she and I talked quite a bit, so.
Okay, well, thank you, Craig.
Thank you.
Very informational. All right. Moving on to our writer and agency updates. So this is where we go around the room, and if you have an update you want to share, feel free. And if you don't, that's okay too. So I will just start on my left. If you'd like to share anything.
No, I think for things at Tri-County, we're wrapping up like Bartonville's active transportation plan, focusing on walking and biking in their region. So that should be by the end of the year. The same thing with the city of Peoria's bicycle plan as well. So those are mobility that working there coming to a close in the next couple months at least.
Updates from IDOT. There's a regional maintenance seminar going on October 29th in Springfield. And RTAC has been on email actually today about that. And if you didn't get one, you can reach out to an email at RTAC and she can provide information. What else? It's beneficial for maintenance staff, support staff to know what warning signs to look for and the repairs done as a protection of the roof, windows and doors.
Is there a deadline for that?
Well, since it's the 29th, I'm not sure if there's any deadline for registering. But probably should reach out with our tag. I don't know. Another update is for consolidated vehicle protection. This application will come out in early 2026. And not-for-profit applicants should make sure they're in good stead beforehand. So, you got
Good standing with you.
GATA, it's the grant accountability.
Website. Website for grants that everybody loves. All right, Jody, go ahead. I just have a couple of updates. So I went to a statewide transportation meeting at the statewide independent living council meeting, and Shelley's on the phone, on the internet. And then Rima was there as well as some transportation providers from other areas of the state. And it was very well attended to the point where I think Shelley's looking at moving it to a different location next year. And then the other, I don't know that it's an update. It was, I guess it's just an odd call that we got. We got a call from Champaign wanting to know about transportation from Champaign to Peoria on a daily basis for dialysis. And if there was any way to coordinate that. So we're like going, she needs to reach out to her managed care organization to start with. And that's a big ask for daily transportation to and from Peoria. So that's pretty much my updates on transportation. All right. Go ahead, Angel.
Hi. I don't have a lot of updates. We've been actively recruiting for employees and drivers especially, and we've been doing pretty good on that. Unfortunately, TransDev will not be the provider of CityLink or CityLift and CountyLink services as of November 30th. Another company called WeDrive will be in place. I will not be part of that program, so you will have to find another person for that, for this position here. We will be coordinating with them as much as possible for the transition. And at this point, there's just a lot of unknown information. So unfortunately, I can't provide a lot of that information at this time. That information should come from CityLink as they learn more as well. And that's all I have.
Thank you, Angel. Thank you. Commission.
Our ridership on both the paratransit and the 62, age 62 plus are both up and anywhere from 10 to 15%, which is great. We've got a couple of new riders on the paratransit side that have made that figure go up, and then on the side, the age 62, I think it's just the word's getting out even more, and the service is really doing well. We had added, we had a problem with when we put medical rides. We actually put medical rides on our senior ride service, not paratransit rides. So people who are ambulatory, we can take them to Peoria and to East Peoria. And we also added Morton because there was a missing niche between Morton and Washington. So we've added that, and that helped the numbers as well. You know, anything out of our area, like, you know, people living in Washington going to Eureka for services is provided by We Care. And so, but we couldn't make that We Care link work between Washington and Morton. But so this answers part of that, you know, part of it, maybe paratransit at some point in the future.
Nice, thank you. Jerry, you got anything for us?
Nothing too crazy, nothing of like huge significance, but there's been an increase in residential occupancy and then more as far as the nursing facility. So it's been more appointments and more transportation, 6 to 7 days. So that's been good.
And you still use your own vehicles?
Yes, we still use our own vehicles. We have 2016 Caravan, 2010 Dodge Transit. We have 2 14-passenger Elkhart coach buses. We do have 1 CDL bus, but that is broken down for the vehicle future. We're looking to get rid of that, but as far as the ETA, I'm not too sure when we put it, but everything else is good business.
Is that vehicle that's broken down, is that from an IDOT grant or not?
I don't think so, because we have our 2 charitable buses that we use right now, 27. That IDOT came in foreign. So when I came into the position, it was already out of commission. But I don't think it registers under IDOT, I guess, thankfully.
Okay, yeah, because that's a whole different process.
Yeah.
That's why I asked. All right, go ahead, Dave.
I don't have anything to that.
Sounds good. Don?
Had a surprise IDOT inspection last week. That's about it.
Shamron?
All the information that I have right now is about Southern Bus. We are going to have our kickoff. It'll be October 10th at 10 o'clock. And so 10 at 10. And they'll be at the Kroger Shopping Center. New this year because we work with all the Kroger locations in Peoria. But as many of you know, sadly, the Sterling Kroger closed down. So we are expanding our efforts. So we will be working with Kroger and all the Krogers in Peoria, East Peoria, which we've worked with them in the past, but then new this year will be Pekin. So we're excited about the opportunity of helping Peoria Friendship House. Years when we stuff with us, so we'd like to raise 3 times or more. So just increase the location. We've got some things like this area, and we just want to stuff with us. So that's what I have on there. And then with the lead drive-through, I would have to turn that over to Brad for this one call as well, because I really don't have that much information.
Alex? Moving on, we got 2 left in the room.
No other things.
Okay, we just heard from you, Craig, but you have anything else?
Completed our NCD report yesterday. God, that's done. And then we did hear from Medicare or Medicaid today, so that's all I have.
Okay, so we will shift to online. I'm going to start with the people whose names I can see, and then I'll continue on after that to the phone numbers, only because they're unlabeled on my part, on my screen. So let's start with Brad from CityLink. Any updates?
No, I don't have anything at this time.
All right. How about Gavin from Tri-County?
Yeah, hi everybody. I just wanted to talk a little bit about the bus stop accessibility plan. You may have received a document from REMA, but essentially the purpose of this plan is to inventory and analyze the various bus stops within the CityLink service area and the membership jurisdictions, and provide a list of stops that should be prioritized for improvement, specifically with regard to ADA accessibility. So a lot of this will be taking some notes from the HSTP document and applying them to our inventory, such as transit dependence, collision data, land use mix, and traffic congestion. So yeah, that's just a little brief update for me.
Yeah, and he's talking about, there's a handout, it's just on that table, with our, learn more about that project that's going on. Next on my list, I see Megan Brake.
Yes, hi everyone. Just one small update. We have an event every year called the Career Summit, and that is an event for high schoolers, high school juniors, and it's hosted at ICC. And we are doing a fundraiser for that event. It's basically for those juniors to get exposure to different careers. And so we're doing a fundraiser tomorrow. I'm going to send a flyer to your email, and if you take the flyer, anything that you order from any of the four Avanti's locations, 15% of that will go to our event that we're hosting in March. So we'd appreciate any support that you could give us. So thanks.
Moving on to Sabrina Bedango. I see you're there, you're unmuted, but we can't hear you. All right, we're gonna move on, but if you have something, you could type it in the chat and I can read it out loud. How about Shelley Richardson? Do you have any updates you'd like to share for the group?
Thank you for allowing me this time. Since we had our annual transportation meeting at Silk, Ryan Croak from the governor's office was there, and he put me in touch with let me grab my notes I just had, with a Jill Hayden, who is she is the executive director of the Illinois Association of Medicaid Health Plans. So she has member organizations which include the MCOs. We had a meeting explaining to her the problems that we're having with non-emergency medical transportation. And she, in turn, put together a focus group on transportation. And when these people got together, they couldn't believe that these problems were actually occurring, and they didn't seem to understand why they are occurring. But we had a meeting again with her yesterday, and we assured her that these problems are occurring. And I know Terry Finn and Riley Anderson from Southern Illinois regions had put together a very organized document explaining the problems that are going on and the takes from the transportation providers. And so we are coming together again within a month, probably, with this transportation group that represents the MCOs and Ryan from the governor's office and myself and some other people, also transportation providers, hospital systems, so that we can really get all of this out on the table and really start to work on this. So I would ask you, if any of you have problems that are occurring, if you could go on our website, it's SILC of Illinois. We have a transportation form. We call it a complaint form, but if you will just put the specifics of the problem. I know that we need those problems. We need to address those problems in this upcoming meeting. The governor's office is asking for these problems so that they can begin to work on these things and really make a difference. So please, it's SILC of Illinois, and you will see the form. That's really all I have. It also not just about non-emergency medical transportation, but any transportation issues. People don't have transportation to get to their jobs. Employment is a really big issue. You know, we're in the phasing out sub-minimum wage right now in the state of Illinois. And there's going to be many more people that with disabilities that need to be able to get to work, get back and forth. And so any kind of situation you want to put on those forms for the governor's office to hear, I would really appreciate it if you would do that. And that's all I have. Thank you.
Right, thanks, Shelley. Yeah, that is some good advocacy that we need on the state level. All right, next I see Tracy Dowell. Anything to share?
There's nothing new on our part.
All right. And then I did receive a message from Sabrina Bedenko from Ivy Sill. She said nothing to share. All right, so now we'll move on to the folks who have phoned in. And I remember a couple of them. I'll have to ask for a refresher for a couple of the rest. So how about Chris Mitchell? Do you have anything you'd like to add?
Yes. I recently tried to attend the town hall meeting that Senator Dave Kohler put on at City Hall here in Peoria. And some of this relates to just everyone because they didn't put an end time of the meeting, and I did sign up for City Lift, and they were very kind, but I knew that I personally could not move fast enough to maintain safety if I had to wait outside of City Hall. And so I have written an email asking people to please have phone and virtual access to these meetings because there is an opportunity for downstate Illinois to get more funding, which Representative Kohler could probably explain to all of us if he came to speak to this group as well. He said there's potential action in the veto session or the next vote will be in June if it supports our needs. One thing I can say that I get really good service from City Lift, and on the 23rd of September, I watched the road supervisor and drivers work very well together and be very courteous to me. But I also know that when I've tried to use after-hours transportation to get home from Methodist Hospital Carl now, which was a while ago, that because they didn't even ask me if I could take my assistive device in their vehicle, I had to advocate to talk to them, which the staff found really unusual. And then in the process, my assistive device was broken. And I had to find someone to fix it. And, going home from an emergency room and realizing the next day that your device doesn't work as it should and you can't be safe on it was quite a surprise because it was like 4 a.m. when I got home. Now, saying that, I'm also saying that I got good kindness, but true surprise that a disabled person would want to have a say in how their vehicle, their assistive device was handled, that they didn't need to talk to the people to make sure that they would get the device inside. And there's a lot of thinking that the disabled person doesn't need to be involved in those decisions. And I hope we can work for that as we fill out forms about experiences. And I have to say that I haven't been to an emergency room for over a year. So is there a date about the sharing of experiences that you want? That, I mean, writing out a complaint form or adapting it, because I can't fill in the spaces on the screen. I don't know how to do that. So I probably have to write it out in a narrative. Is there a date? Because it can take me, I type 3 words a minute. So I'm willing to share, but if it's not going to be counted, I probably need to focus on something else. So
Chris,
if you can get back to me about that, I would appreciate it.
Chris.
Yes.
Okay, this is Jody.
Hi.
Hi. And actually, the site that Shelley is talking about is the one that you and the other resident at your place have called me about, and that I have put the complaints in.
And you've done a really good job, Jody. Maybe I already complained about it. I mean, because it was a while ago. And
Yeah.
I would like to thank Advocates for Access for making participation so much easier, and for their presence and support. Because, for example, where I live, we are a fairly, not completely, but fairly accessible facility. And currently we have 3 openings for anyone 55 or older. And that is disabled or elderly. So feel free to contact me if you need to. And thanks for the clarification, Jody. And Rima, thank you, everybody.
Thanks, Chris. I appreciate all your feedback. It was very specific. Okay, so I remember a couple others on the phone were from Fulton County. How about Shelley Entrikin? Still on? No. How about Audra Miles?
No update.
No updates.
Oh, there we go. I heard you both. Thank you. All right, and I know I'm missing one more person on the phone. Is there someone whose name I didn't call?
This is John Corey here from Bloomington.
Okay, would you like to share just a very brief couple-minute update about some relevant things to the group?
This past week, I was able to meet with the Representative Sharon Chung in her Bloomington office and advocate for the transit bill, the 3438 House bill. And I do believe she's in favor of it. And she suggested I meet with Senator Kaler as well, which I will. And that bill has a lot for transit, as you all know. And the only other thing, I've been advocating a long time to get CityLink expanded to Morton, and just working on that. I'm going to speak with Mr. Durdell from We Care. There's a concern that if CityLink came to Morton, it would take up some of We Care's funds. And Rima, I might ask for your help in finding that out, or maybe Laura Calderon from IPTA to get an answer to that question, and maybe we could move on. CityLink used to come up right to the edge of Morton for decades, and we missed the opportunity to have transit at very small incremental cost. But then they took away their Route 150 service, and now it's going to cost a lot more to get that back. It's kind of disappointing.
All right, thanks, John. Yeah, lots of stations there.
Thank you.
Thank you. Okay. I think I touched on everyone here. So we're rounding out our meeting. We just have three more agenda items. So moving to the coordinator report, that's me. I'll keep it short. So last week I was at the Illinois Public Transportation Association, the IPTA conference. And they always do a very good job with that. And just a couple notes that I wrote down from some sessions that I attended. There were actually the keynote speaker plus another session. They talked about how parking regulations across the city can influence transit, how people use it, if people use it. That was a very in-depth issue that maybe one day talk about parking here, so we can get more transit in to the people who need it. Another interesting session that I sat in on was Connect Transit in Bloomington. So there was a change in how that rural transit is handled in McLean County. So now Connect Transit is doing rural transit in across McLean County. They only used to do city buses, so rural transit is new to them. But they brought the people they have working on that, and they're doing their best to fill in the gaps. A lot of learning. It sounds like they're making good progress, so that was good to learn. For regional neighbors. Let's see. I know that the Peoria Transit meeting, I sent an email about it. Chris mentioned it. So that's the one where Dave Keeler came to Peoria City Hall. I couldn't make it, but it sounded like there were a lot of good conversations there that happened. So hopefully move forward with any kind of legislation that is worked on. So that's a big piece of conversation now. And then my last thing is just that actually today, starting tomorrow, I'm going to a conference in Chicago. And this is the American Planning Association Illinois chapter. So if you email me starting tomorrow, then I won't be available this week, but just always learning more about how we can make our region better. All right, moving on to other. I will open it up to any last comments, concerns. We've got about 5 minutes. Anything else anybody wants to share?
This is John Corey from Bloomington again. I have a positive something to share. Burlington Trailways, which is a family business that served the I-74 market from Quad Cities to Indianapolis, went out of business last week. Jefferson Lines, which is a 100-year-old company from Minnesota, did a whirlwind of activity, purchased some of Burlington's coaches, hired some of their drivers, and with no interruption of service between last Saturday and last Sunday, we picked up the I-70 route through Peoria. So we still have connectivity along I-74.
Oh, that's awesome.
It was great.
That's great to hear. What was that company?
Jefferson Lines.
Okay.
Headquartered in Duluth, Minnesota. No, Minneapolis, I'm sorry. Very good people.
Okay.
And they also are an Amtrak throughway carrier, so they coordinate bus and rail tickets at Normal, Champaign, and Indianapolis, and Quad Cities in the future.
Thanks. That's a wonderful way to end this meeting. I appreciate that. Okay, anyone else? Any final remarks? Well, our next meeting is Tuesday, December 2nd. Same place, same time, here at Epic at noon. We will invite Craig once more to talk about the urban side. So we're going to be experts about Knox County and Galesburg by the end of this year. Thank you for that. Thanks everyone for coming. And I'll adjourn at 12:57. Appreciate it.
Thank you, Rima.
Thank you, Rima.
Thank you.
You're the best.
Yeah, nice to meet you.